In an effort to try to stretch out the nation's limited supply of monkeypox vaccine, federal health officials have authorized a new way to administer it. People will now get 2 shots spread out over the course of a month, but with just 1/5 the dose that they're getting now. The injection will now also be just under the top layer of the skin rather than deeper into the fatty tissue under the skin. Ground Force Dan Kerman talked with Bay Area doctors for their take on this change.
In hopes of making a limited supply of monkeypox vaccine available to a larger number of those at risk, the new federal health strategy calls for giving 2 shots of the vaccine 1 month apart. However, the dose would be 1/5 what it is now, and it would be injected under the skin as opposed to deep into the fatty layer of the skin.
Most people believe that it will probably give protection, particularly if you can blanket immunize the entire population in a very short period of time, which is probably better than just immunizing some and not others.
UCSF infectious disease specialist Dr. Peter Chin Hong says this strategy has been used with other vaccines and is proven to be effective, though there's only one study showing its effectiveness with this vaccine. Still, he says, with limited supply and a high-risk population of more than 1.5 million people who need 2 shots, this is the proper course of action.
In a public health emergency where we don't have enough vaccines and infections and disease are spiraling out of control with risk of going into the general population, that it is enough evidence to make a public health intervention, and that's what is happening right now.
It's an okay idea. I'm not opposed to it, actually. I just don't want it to be used in people with HIVs.
UCSF infectious disease specialist Dr. Monica Gandhi agrees this is a strategy that's worked before. But Gandhi, who also serves as director of General Hospital's HIV clinic, believes the smaller dose should not be given to those with HIV.
We don't usually kind of go out on a limb with vaccine strategies in immunocompromised patients. We usually want the highest dose that we could get in immunocompromised patients. We've seen that with the booster campaign with COVID-19.
Federal health officials have promised additional studies in the coming months. Dan Kerman, Cron 4 News.